Looks like the wall of a post office.
Good morning, and thank you for joining us today for the May meeting of the Commission to Combat Drug Abuse. I'm Doug Huntsinger, the Executive Director for Drug Prevention, Treatment, and Enforcement, and Chairman of the Commission. Seeing as we have a quorum, let's get right to business. The meeting minutes were sent out in advance. May I have a motion to approve the minutes? From Dan, a second?
Second.
Terry, all in favor? Opposed? Perfect. The minutes from the February meeting have been approved. I want to begin today's meeting by thanking our legislative members and our partners across the state for their unwavering support in our efforts to defeat the drug epidemic. This past legislative session was a win for Hoosiers on all fronts, and especially those with mental health and substance use disorders. We saw historic investments made in mental health and addiction efforts that will have an impact on Hoosiers for years to come. Expansions in telehealth and broadband will allow us to serve rural and underserved communities in ways that we wouldn't have been possible just over a year ago. Removing failure to appear as a reason for driver's license suspension will help thousands of Hoosiers get back on the road to treatment and find jobs during their recovery. We're expanding access to mental health treatment for those incarcerated in our county jails, and our opioid treatment programs have the flexibility to provide extended medication to patients while also being held accountable to state regulations. And our syringe service programs have received a 5-year extension beyond the previous 2022 sunset date, ensuring these programs can continue to focus on serving their community and continue to be an entry point for treatment. While no amount of money or new legislation can undo the devastating toll inflicted by the drug epidemic, these are just a few steps toward helping Hoosier families recover from this crisis. Before we get to our first agenda item, I'd also like to recognize the Family and Social Services Administration team behind the Know the Facts Anti-Stigma Awareness campaign on their recent Emmy nomination. You'll remember back in February of 2020, FSSA presented on the phase of the ad campaign with a renewed focus on the recovery journeys of real people like Tony, Stacy, Alvina, and Cody. This month, you'll begin to see new advertising spots and billboards and TV commercials, and driving home a simple message that addiction is a disease, but with support and treatment, recovery is possible. So congratulations to the Know the Facts campaign and are the featured Hoosiers in recovery for this great accomplishment. We know that, now I'd like to introduce Jeannie Reed, diversion specialist and peer recovery coach at PACE ND, which is one of our 17 regional recovery hubs. I've asked Jeannie to take a few minutes to tell you how a crumpled brochure and the word reentry changed her life. Jeannie?
Thank you so very much. And I just want to thank you for giving me this space for people like me to have our voices heard. I appreciate that. So my name is Jeannie, and I am a diversion specialist here at PACE. Prior to that, though, I was identified as 247748, which is my DOC number. I have struggled with substance use disease since about the age of 15. I also had a lot of incarceration due to that drug addiction. A lot of my charges were related to being an addict and trying to survive out there. However, I always say it was a rescue, not an arrest. But for me, my story is a little different because a lot of times we treat addiction as a crime when it's a disease, and people are being put away because they have cancer. Addiction. I mean, addiction is a disease, and sometimes we forget about that. We feel like it's a choice, and it's really not. So I'm a little nervous, so please bear with me. So my journey is a lot like a lot of other people who have SUD or substance use disorder. I found myself in a very bad spot, and I had been detained again. I have been incarcerated a couple of times. I've been to prison 3. And all those times I never found any help for my disease, just locked away and put away and sit down and hush and take this time. So on my last journey, my last away time, I was at Madison Correctional Facility re-entering, and I was so nervous and so scared because I had no idea how to go about that. I had found a little pamphlet crumbled up in this re-entry book, and it had some writing on it, some stains on it, and it said re-entry. I said, that's what I'm about to do. I'm re-entering back into society. Heck, I'm re-entering into life, and I didn't know what that meant or even how to go about that. So I'm going to be honest, I stole that pamphlet out of the re-entry book, and it was the best thing that I could have ever done. I was released from prison on a Thursday, and I was here at PACE prior to COVID in 2018 at their doors on a Monday. And I walked in, and as I was walking in, that DOC number I stated, that 247-748, was left outside. Because when I came in these stores, I was treated like a human being, a person, and I had not felt that way in a very, very long time. I walked in, and I just didn't even know. I had no kind of skills. I hadn't had a legitimate job in years, nor did I even know what resources were out there for me. A lot of times when we're in active addiction, we don't know how to ask for help, or we don't know where to turn to get help. Thank God there's places like PACE here and in other areas for people to get that help that they're desperately searching for. I was desperately searching, and I found it. So I came in, was treated like a human being, and greeted with smiles. And these people that I now call family helped support me and break down some barriers. I had no voice. I didn't know how to speak up. I didn't even know what was really going on with me. And through their resources and their support, they supported me in giving me some strength and knocking down those barriers a lot of us addicts and just as involved people come up against when coming back home. So I really don't know how long I have to speak, but I just want to say that here at PACE now I'm able to help people just like me. I see me walking through these doors as a staff member now. Not only was I a client, but now I work here, so I can relate to those fears that these people are having coming in, not knowing where to go, not wanting to live, but not even knowing how to, needing support and not knowing where to go. I wish I could hug them, but because of COVID, we can't. But what I can do is I can sit and listen, and I can say, hey, you're not the only one. I remember feeling like I was the only one. I remember not having a stable place to call home, a safe place to go home to. I remember not having clean socks, and those are the things, those little things are things that we need when we're trying to rebuild and to be reborn. So I am very grateful for the opportunity to sit down with people who are like, hey, no one understands what I'm going through. I do. Our stories might be different, but I get it. I can relate to those sounds and the trauma that you might have experienced while locked away. Because that's how we feel. We feel locked away and forgotten, falling through the cracks. At least that's how I felt. And a lot of other people just like me feel that same way. So we can recover. I just want people to know that just because we have a substance use disorder does not mean that we are taking from society. Today, I'm able to give back. We do recover from addiction. Is it a quick fix? I wish it was, but it's not. It is a chronic disease. We cannot put Band-Aids on those things. It's a lifelong journey with a daily reprieve. Today, I'm walking before I wasn't, and I might not be here today if it wasn't for places like this in the community to say, hey, you're not alone. We got you. Come on in and let's figure some things out. Thank God for that. So I guess here we don't, and I wish there was more places that could support. And I know that we're working. It takes a community to raise a child, right? I've heard that saying my whole life, and I really didn't understand it. I get it today. It takes a community of supporters and resources to guide people and just walk around with them. Substance use I don't have to be a statistic today. And there are thousands and thousands of other people out there just like me, looking not to be a statistic, to be treated as a human being. And I don't know, I'm just very grateful, but we need support. We need funding. We need resources. We need people who just can take the time and say, hey, we got you. And it takes a community. So I don't know. I just am so grateful to be here and have my voice heard. And I don't say I represent all the addicts, but I am an addict, and I found a voice. So I appreciate you guys taking the time to sit and listen to me. And I'm about to get teary-eyed, so I'm going to pass the mic on over. Thank you so very much
for joining us. I think you said it really well, and thank you for being part of that community that's helping people who are reentering and dealing with, as you put it, a chronic disease. So thank you so much, and just thank you for all the work you do. In February, the Attorney General's office approached our team in the General Counsel's office to begin to lay the groundwork for an anticipated settlement in multiple opioid lawsuits. So I want to thank everyone who was involved in our legislative efforts this session. I think we can all agree that it's the kind of the groundwork for what we're going to hear moving forward. But we've asked co-chief counsels Betsy Donardi and Corey Voigt of the Attorney General's Office Complex Litigation Division to give us an in-depth look in these proposed settlements. So I'll turn it over to the two of you.
Thank you, Director Hunsinger and members of the Commission. My name's Corey Voigt. I am, as was just mentioned, one of the directors of the Complex Litigation Division here at the Indiana Attorney General's Office, along with Betsy Donardi. We're going to give you an overview of litigation that the state has brought in the last several years. And potential settlement and bankruptcy distributions that should hopefully be coming in to the state in the next several months, over the course of the next several years too. And as was just mentioned, there was recently legislation that was passed, and we're going to talk about that briefly also. The office has been involved with opioid litigation and before that investigation for several years now. So I'll go ahead and start. So the state filed a civil lawsuit against Purdue Pharma in November 2018. Purdue Pharma, of course, is the maker of OxyContin. That matter is currently stayed due to Purdue Pharma's filing of Chapter 11 bankruptcy within the last year and a half. The state also filed a civil lawsuit against members of the family that owned Purdue Pharma, the Sackler family, in May of 2019. Along with the bankruptcy, filing, our filing against the Sacklers has been stayed. The state filed a civil lawsuit against Cardinal Health, McKesson, and AmerisourceBergen in October 2019. Those are the distributors of the opioids to the pharmacies. And the Office of the Attorney General has been participating in a possible settlement with drug manufacturer Mallinckrodt through its bankruptcy filed in October 2020. Finally, the state filed a civil lawsuit in a consent judgment very recently against consulting firm McKinsey in February 2021. The settlement funds are all payable to the state, with the first funds received last month. Next slide, please. Now, the information we're providing today is, of course, subject to change, and that's true for the information based upon Purdue Pharma. And the Chapter 11 plan proposed plan was recently filed, but it's pending approval by the bankruptcy judge. In order for the state to receive disbursement, we must have either a plan agreed to by the state and the political subdivisions, or the distribution will revert to a default plan. With the legislation that was recently passed, that kind of alleviates the concern here about bringing the political subdivisions into the fold, and the legislation in some sense follows the default plan in this bankruptcy matter. The deadline for the plan is 14 days to be filed, effective after the Chapter 11 plan is approved. Next slide, please. The Chapter 11 plan designates that the FSSA is responsible for dividing the state into regions. Marion County and Lake County will each be on its own region-based region based on its population. The money will be split between the state and the regions. All funds must be used for approved opioid treatment, prevention, and education programs. And there's an 11-page document that's been filed with the bankruptcy court that details a variety of different programs that may be utilized in order to facilitate the abatement of the opioid problem. These funds, of course, are subject to public audit, and the state will have to annually report this audit. That's Purdue Pharma, and that's what's happening in the bankruptcy court. We hope to see a distribution of those funds at the earliest, probably by the end of the year. And I'll turn it over to my co-director, Betsy Donardi, to tell you about other potential distributions that may be coming into the state.
So I'm going to talk to you about a potential settlement with the distributors, which Corey mentioned those distributors as Cardinal Health, McKesson, and AmerisourceBergen, which the state of Indiana has sued. As you may know, many cities and counties within the state have also filed their own lawsuits, and those lawsuits have all been combined and are in front of a judge in Cleveland, Ohio. We also have a potential settlement with Johnson & Johnson, who has a unit of its operations called Janssen that was responsible for manufacturing a specific opioid product. So those potential settlements we hope would involve all of the subdivisions within the state of Indiana, the cities and counties, as well as the state. The potential settlements are under discussion, and so they haven't yet been finalized, but numbers have been disclosed by both Johnson & Johnson and the distributors. And so the distributors settlement would be for all of the states, would be $21 billion, and then Indiana would receive a portion of that. And then for Johnson & Johnson, their disclosure indicates that the settlement would be $5 billion, and then a portion of that settlement would come to the state of Indiana. So based upon what we have heard from those who are sitting at the negotiating table with the distributors and Johnson & Johnson, which is not Corey and I, but from other states, is that any settlement with either the distributors or with Johnson & Johnson will require the cities and counties buy-in in order to obtain the full settlement dollars. So what they have planned is that there will be a base structure and a bonus structure for the payments. And so based upon the information that we have received currently, the amount for the state could be reduced by up to 50% if we do not have sufficient buy-in from political subdivisions. Now, we have passed legislation here in Indiana that we hope will prevent that 50% reduction, but I'm sharing this information with you so that you're aware of what the potential ramifications are. The money would then be divided between a specific amount for state spending, a specific amount that would go to the political subdivisions for spending, and both of those would be unrestricted use, so the state could spend it on however it wanted. In the political subdivisions, the cities and counties could spend it as they want, and then the majority of the money would then go to what we are calling abatement, which is those approved uses that Corey mentioned for opioid treatment, prevention, and education programs. So I have on the next slide some information about how those base bonus structures will work. I'm going to run through that quickly because we're hopeful that we have, through our legislation, prevented any concerns about those specific different bonus structures. So for Johnson & Johnson, the base payment is around 50%, and then there is a bonus payment that you would receive if you have a legislative bar that prevents subdivisions from filing litigation, which our current legislation that was passed has that bar in it. So the hope is that then we would receive the full payment from Johnson & Johnson. This slide shows if we were unable to have that bar, that there are different varying payments that would be received based upon the ability to obtain buy-in from different populations of different subdivisions based on their population. And so the hope was that in passing the legislation that there will prevent the state from having to deal with those different payment options and those different amounts of money not being provided to the state of Indiana. The same is true for the distributors. It's just a varying model for how those payments would be received. So the structure of the distribution is it is anticipated that when we have any settlements or with Purdue Pharma that through the bankruptcy court, that the funds would be received on a yearly basis. It's also possible that if, as Purdue Pharma continues on in its new form, if they sell off assets of that company, that there would then be distributions to the states based upon those asset sales that could come at any point in time during the year. The goal of our office and the goal of the settlements is that as many funds as possible should be moved as quickly as possible into programs that benefit Hoosiers within the state, because that's the designated use for as many of the funds as we can put towards those uses. So our key when we were originally doing this was to try and get as many political subdivisions on board in order to maximize the amount of money that was coming to the state of Indiana. Our hope is that through the legislation that was passed, we have achieved that, and so we're able to receive 100% of the distributions in the event of a settlement or through Purdue Pharma. There are, if there are no additional subdivision lawsuits that are filed, no cities and counties file new lawsuits, that gives us the additional 5% to get us to 100% of the payments. And then the subdivision funds will be funneled through the state, or they could be paid directly through court actions through that multi-district litigation in Cleveland. So I want to talk a little bit about some of the opioid legislation that was passed. This doesn't go through all of the legislation, but it gives you the main points. So it was passed as part of the budget bill this year. It provides for the division of all of the funds from any of opioid lawsuits or settlements as follows. So 15% of any settlement will go to the state for their unrestricted spending on however the state would like to spend that. 15% will go to the political subdivisions on a per capita basis. And then 70% of the funds will be used for opioid treatment, education, and prevention programs. As part of the legislation, the General Assembly has put FSSA in charge of doing certain things. They will receive the program, the 70% bucket, as an annual appropriation, and then 50% of those funds have to be allocated to, when I say community-based programs, those are programs directed by the political subdivisions, by the cities and counties. The remaining 50% can be allocated and used for other state-related programs, but all of it has to be used for those types of programs that Corey mentioned that are in that 11-page document, which provide a lot of different programs. They range from education type programs to programs where you can, provide additional naloxone, community-based programs in jails. There are programs that can be provided related to drug court. It is a massive list of different types of programs. And then FSSA is also required to divide the state into regions based upon their population, so that will allow for the spending to be based on a regional approach rather than a specific city or county type of approach. They can utilize data from 2018 through 2020 calendar years related to opioid use disorder when determining those regional funding allocations, as well as population. As part of the legislation, there's also reporting requirements. Any entity that receives settlement funds that are to be used for those education, treatment, and prevention programs have to monitor the use of those funds, and they have to provide a report to FSSA by the date determined by FSSA. FSSA is also responsible for providing an annual report to the General Assembly of all of that information by October 1st. And the report has to detail all of the funds that have been committed and the use of those funds. As Corey mentioned, for Purdue Pharma, because it is part of the bankruptcy court, we have an obligation to provide an annual report of the funds that we've received from Purdue Pharma. And so that this report that FSSA will put together for the General Assembly will also meet our obligations under the bankruptcy court's, the anticipated bankruptcy court requirements for a annual report from the state as well. And so it is anticipated, as Corey indicated, that hopefully from Purdue Pharma, if their plan is approved, that we will start receiving funds from them end of this year, early next year. And then if the settlements go through with Johnson & Johnson and the distributors, we anticipate that we would start receiving those funds shortly after those settlements are resolved. But at this point, obviously they have not been completed. And so we don't have an estimated time frame for when those funds will be received. So that is the information that Corey and I have for you based on the work that we in the office have been doing. If there are any questions or other information that you would like from us, we're happy to answer those questions.
Any questions for the Attorney General's office from members of the commission?
This is Senator Yoder from Monroe County, and I had asked some questions about local units, those counties that were in their own distinct litigation. Will they have any say over how those dollars, will they have input? And if so, how will that happen? I think Jay was going to address this, and I would love to hear how that might happen, because I know my elected officials are curious.
Well, so Larry, Corey, or Betsy, do you want to just first talk about that 15%, and then I think Jen, Jay, and I can address the 70%.
Sure. So I'll speak to that. And before I do, I just want to say that we provided some rather technical information in our presentation. But when you hear a story that was presented at the beginning of the meeting, for us doing this work over the last couple of years, it's easy to lose sight of where this money is going to and how it's going to help folks. And hearing that story really invigorates me and makes me want to do good work to get this money to Hoosiers. Make sure that the Office of the Attorney General is instrumental in doing that. So with that being said, the 15% is unrestricted. And and there's 15% at the state level that's unrestricted. And then there's a 70% pot that will be specifically dedicated to abate the problem. But the 15% unrestricted is going to be distributed on a per capita basis. And, the thought process behind that is we want to be as equitable as possible with how these funds are distributed throughout the state. And Senator Yoder, I think that gets directly at what you're talking about. And that was one of the things that was front of mind when we discussed this with the folks we discussed it with, is that we want the funds equitably distributed throughout the state so everybody can participate in this settlement. It's Hoosiers money. So with that, I'll turn it over to you, Director.
Well, thank you. And I know we've been having a lot of conversations. Jay is going to present next on a lot of the federal funding that we're going to be receiving here in the state. And with that, we're still waiting on guidance on how we can spend some of that. This money is often in the settlement restricted for opioids only. So there are some challenges as we integrate those funds into kind of that full continuum that we're trying to build out in many communities. But I think we have been engaging with the stakeholder groups from the subdivisions. And as we get more information and as the settlement becomes more firm, we will definitely continue to have stakeholder meetings with the subdivisions, whether it be our cities or counties as well. Jen or Jay, do you have anything you'd like to add? Okay. Any further questions? I'm sorry, I can't actually see everybody.
All is well.
Any questions? Just go ahead and speak up. Okay, not hearing anybody. Thank you, Corey and Betsy, for your presentation and also your collaboration over the last several months. Also, in the last several months, we've been engaging stakeholders across the spectrum in a series of roundtables to identify gaps and learn where the state can supplement local efforts and expand or enhance the work that's happening at the ground level. So I'd like to thank Jay and his team for co-hosting these discussions, and Jen for her virtual participation as well. And so I'll turn it over to the Director of the Division of Mental Health and Addiction, Jay Chaudhry, who's going to walk us through the federal funds that we'll be receiving and a timeline and how we plan on distributing some of these things.
Thanks, Doug. Good morning, everybody. Glad to be here to talk about this tremendous opportunity for the state. And I think we can't lose sight of what an opportunity it is. I mean, we're going to talk about the challenges and the parameters and the restrictions and all that fun stuff. But I think that at our core, we have to number one, thank the legislature for what they've done for mental health and SUD this session. And also just, be really thankful and excited for how we're going to be able to use some of this funding to really transform the lives of Hoosiers that are suffering from mental health and SUD issues. So we're really talking here about four distinct, really, you could even say 6 distinct buckets of money. And all of these buckets have different timelines and different restrictions. And so, I won't go too into the weeds of what those are, largely because we don't really know a lot right now. But we hope to find out in the next coming months over the summer. I think we'll have a much better idea, hopefully, about all of this by the time the next state fiscal year starts in July. So, starting at the bottom left there, we had the Federal Consolidated Omnibus Appropriations Act, which was passed in December 2020. And that provided an additional $30 million in funding for the Substance Abuse Prevention and Treatment Block Grant, as well as $15 million to us for the Mental Health Block Grant. It also provided an opportunity for community mental health centers to receive funding directly from SAMHSA. And so we're working with our CMHCs to make sure that they maximize and take advantage of that. This is the only one of the federal initiatives that has any movement underfoot right now. SAMHSA has our plans for this money, and we're still waiting on final approval there for that. So, and I'll get into some of the specifics about what we asked for approval to spend it on. And then, fast forward to March 2020, we had the American Rescue Plan Act, and there's two buckets here that are relevant for the state. An additional $30 million, and these are estimates because we don't know specifically yet, but this is what we think. An additional $30 million for the Substance Abuse Prevention and Treatment Block Grant, and then between $15 and $30 million for the Mental Health Block Grant. There are pretty specific guidelines on all of these. They generally have to be used for for prevention treatment of substance abuse, or on the mental health side, they have to be used for services for individuals with serious mental illness. And so, we are kind of restricted there. And then also part of the American Rescue Plan Act was the state budget bill, which actually be House Enrolled Act 1001. And the legislature appropriated $50 million in each of the next two state fiscal years for mental health grants. We are still awaiting guidance kind of state government wide on what the restrictions and parameters of American Rescue Plan Act dollars are. So until we know that, we really can't even begin to speculate about what we want to use that on. And then finally, you heard about the opioid litigation settlement, and a lot of that is just to be determined. So what's the common factor here? There's a lot of uncertainty, but there is a lot of excitement, and we have been thinking a lot about how we're going to use this money. And so here are some considerations that we're taking a look at. I mean, probably most importantly, and we all know this is one-time money. And so, we are very cognizant of the notion of building bridges and not building cliffs. So, we want this to be, a journey towards, kind of a healthier, happier, Indiana by 2025 when the last of this money needs to be used, and not a situation where we build up a lot of services and create situations where people are just going to fall off a cliff there. And so how are we going to do that? And I think that there's two particular criteria that we're looking at. And that's for, things with lasting impacts. A couple examples would be the infrastructure surrounding health information technology. It's pretty haphazard and spotty around the state. And so, we're looking at specific ways there. Other process improvements, would be something, we'll take a look at. And then the other would be, we are going to obviously fund services and treatments and stuff, but we need to be able to evaluate the success of those treatments, both from an outcome standpoint as well as on investment. So we want to make sure that we build those in at the beginning. We want to promote evidence-based practices. That this is an area where the field is, again, pretty scattered and spotty, although thanks to the efforts of Doug and Jen and everybody else at FSA and DMHA, we have made tremendous progress in this area. So we want to use this funding to continue to build upon that. Emphasize an area that sometimes gets forgotten, which is recovery supports. The truth is, as we've heard from the field over and over again, we did a huge survey of people that are using our services and living with SUD, and the truth is that recovery is just easier when life is. And so we want to make sure we make life easier for folks in recovery, because that enables them to succeed. As I said, we're trying to navigate and maximize all these different timelines and parameters. So we just want to make sure that we use the funding in kind of the most effective, efficient way. That just kind of generally requires a very good idea of what all those different timelines and parameters are. And as we learn more over the course of the summer, we intend to let our partners know what we find out and how we're interpreting all that. Equity is very important to us, both from racial, socioeconomic equity and geographic equity as well. We want to make sure that this funding gets to forgotten corners of the state, areas that have historically been underserved, populations that have been underserved, and we want to make sure we explicitly call that out. And then finally, transparency is super important to us, and we're going to work on creating public-facing dashboards. Reports for the legislature. We want to make sure we include local partners. To Senator Yoder's point, we'll be having many conversations about this. So, we're really looking forward to those conversations because, ultimately at the state, we only know what the people on the ground tell us. So, look forward to that. And here, just really quickly, just some priority areas. Kind of your prevention is one thing. I think we talk a lot about it, and we need to talk more about it. And one thing we ask for permission to do is provide grants for local communities to build and reinforce their own local prevention infrastructure. And I think that the time is really ripe for this type of activity, given a lot of the other initiatives going on, including, local. The local JRAC bill, for example, that was passed, could be a natural avenue for collaboration. And then we are going to fund, I think, treatment and interventions. We just need to be mindful of those cliffs. That cliff effect, I think, is especially prominent in the treatment space, because if you fund treatment for 3 years and then not afterwards, what happens, to those folks. Again, I mentioned recovery supports earlier. A big thing that we talk about a lot is linkages with the criminal justice system, and so we plan on using this funding to help build up those linkages and trying to divert folks and create avenues to treatment for folks and create reentry opportunities. A big opportunity right now we have is in the crisis and mobile crisis space. I think Indiana has not had a comprehensive crisis response system ever. And we have a real opportunity to use this funding to build up the crisis system and then use that as a springboard into the 988 world, which will exist post July 2022, when there will be a single number dedicated for crisis services that different than 911. It's 988, and so that was mandated by federal legislation. And thanks to Representative Davison, it's been we're the third state in the country where it's actually been put into Indiana code, thanks to House Bill 1468. Workforce, huge issue. One of the biggest issues. It's hard to provide services to folks if you don't have folks to provide those services. And so, we plan on investing heavily in mental health workforce and SUD workforce to encourage folks to come into the field and to make their lives easier once they are in the field. And then finally, this commission has heard about some of our successful COVID programming, so I won't go into details there, but we want to extend and expand on those programs, including the Be Well Crisis Helpline and the regional recovery hubs. So that was a lot of information in a short period of time, but I'd be happy to answer or take any questions.
Questions for Jay?
I have a question for Jay. This is Shelley Yoder again, and I had asked a question about local units and those elected officials having input on the money spent, and I didn't ask the question well, and I think it got to sort of heard as the 15%, but I was asking about the 70%. Will local officials have some say in the evidence-based practices that are used? And we heard from Ms. Reed and her powerful story and the impact of the care and the treatment that she. So that's the question that I really want to ask is, what is the input on the dollars that will be spent on the 70% that locals can know will be done?
Actually, that was my answer. I'd kind of let the Attorney General's office respond to the 15% that is unrestricted. But we do and will, as we get more information and as the settlement becomes more firm, we'll begin to have conversations with our communities all across the state, as we have been doing for the last 3 months with many of our stakeholders in recovery and treatment and our harm reduction areas and also prevention. We will continue to have conversations with those subdivisions as well to understand what their needs are. We completely understand that all across the state, the trends of drug use are different, and also the different types of interventions that have been started. We want to make sure that we're able to continue some of those programs that are evidence-based and are seeing great results.
Yeah, I agree 100%. I don't think we can do it without local input, frankly. So, we're going to be, you're probably going to be sick of us by the time we're done.
Doug, if I could speak to that, a minute too. This is Larry Hopkins with the Attorney General's office, and we did have several conversations with both the cities and counties, or the Cities and Towns Association of Counties. And the intent of the agreement that's in the legislation is to allow their half of the abatement funds to be determined by them in their region. So the state will be split up into regions, and the subdivisions will each be in a region. And so the idea is that regionally, they will make recommendations about how they want those funds, their 50% of the abatement funds, to be spent. That could be a local program that they operate. It could be a state program that operates in their region. There could be a lot of different options that they will be making requests and recommendations to FSSA about how those funds should be distributed. So the intent of this is to make sure that they all have a say, both the ones that filed suit and the counties that didn't file suit, so that they will be speaking as a region as to what their needs are and make those considerations known to FSSA. So it's a little fuzzy yet exactly how they're going to meet as a region and make those decisions and convey that information. But that's the intent, and those are the discussions that we've had with the subdivisions about how they'll be involved in that process.
Thanks, Larry. And I also think it's important to remember on Monday, IEDC announced their READY grants to the different regions. And dealing with mental health and addiction is one of those allowable expenditures within your plan. And so I think in some ways, some regions may already have a plan developed, and whether it gets funded through the READY process or not, that's $500 million that the state is investing in communities all across, or regions all across the state. So I think we'll begin to see some of these natural areas begin to develop, and some plans also come together that we'll have some insight as to how regions are forming, and how we might be able to supplement their efforts in that way as well. There's a lot of money out there, a lot of work is going to need to go in as we continue to get guidance from the federal government over the next many months. Representative, did you have a question? Oh, you're on mute.
All right, can you hear me now?
Yes, go ahead, Representative Fleming.
You mentioned, or Jay mentioned, that this can only be used for opioid dependent individuals. And we know that a lot of people are multi-substance abusers, and if opioids aren't available, then they may go to methamphetamine or another drug. So is that indeed what you said? And if that's the case, how are you going to sort this out?
I believe that was only in reference to the opioid settlement litigation money, and all the other money can be used across the board for other substance disorder. And I don't think it's crystal clear yet that the opioid settlement is 100% opioids only. Is that right, Doug?
Yeah, there are some, especially when you get into prevention and harm reduction, it's wide open. Treatment is somewhat narrowly defined in some of this, but again, it's all, the settlement is all in draft form. There could be changes to the allowable uses of those funds.
Yeah. And I also don't think you can talk about SUD without talking about mental health. And so, to the extent that we're allowed to, and we plan on addressing this, sort of the whole person approach, right? And so, a lot of times folks that end up using substances are working on their own underlying mental health issues. And so, we're going to extend that latitude as wide as we're allowed to. Obviously, we can't extend it any further because then we
This is Betsy Nardi. If I can add something, that 11-page document that we're going to send you of the approved programs specifically states that it's supposed to be used for opioid use disorder and any co-occurring substance use disorder or mental health treatment. So it will allow, if you have a opioid use disorder, but you also have another substance use disorder or mental health treatment, it will allow for you to be using those for both of those, as opposed to solely for an opioid use disorder.
Okay, thank you.
You're welcome.
Dr. Fleming, we also have, as you know, been very intentional from the beginning with the state opiate response grants received 5 years ago in making sure that we harness that broad whole person view of supporting individuals with multi-substance use disorder, with underlying mental health conditions, with all those social drivers of health that need to be addressed, to make sure that Jay's new catchphrase that I love, that recovery is easier when life is, are kind of in the foundational work that has been underlying all of this. So the timing of this and its importance could not be better, that we have this 5-year infrastructure that's been built, and now we get to expand it and really replicate those early successes in substance use disorder for our mental health teams as well. We need them now more than ever. Our post-pandemic recovery is absolutely built on the foundation of this piece that we're talking about today, with all of these different funding sources coming in to set us up for success. If we don't act now, we have 2 generations from now that we'll see this ongoing issue and not being in recovery where we need to be.
Judge Smith?
Yes, thanks, Doug. I just want to clarify with regard to these regions that you're talking about, is that in conjunction with the local coordinating councils, or how are these regions going to be defined? And I guess really my concern is, if for the locals now, what advice could you give the locals if they wanted to start getting ahead of the game and start developing a plan? Who do we know who our partners are going to be?
Yeah, so I think that will somewhat depend on a number of things, right? One, who are you currently working with? What do regions that naturally make sense? What are those already developed? I know there are a number of regions just within the Division of Mental Health and Addiction around the regions that our community mental health centers are involved in, or the regions that we have with our recovery hub. So I think there are all kinds of different ways we can organize the state. But I don't know if Jen or Jay have other thoughts and how they can begin to have those conversations.
No, I'll just add that, one of the most, I think, frustrating things for me is the different regions. And for every single thing, there's different regions. And obviously we can't fix that in one day, but we're very cognizant of not reinventing things. And so I think we're open to suggestions for which of the 10,000 different regional divisions that we have in state government makes the most sense for this particular purpose.
I would also highly encourage that kind of thinking of being ahead of the curve. Anytime that you can make suggestions on how things ought to look, best practices on partnerships, here are the groups that need to be engaged, not necessarily by specific name, but by general grouping. So a community mental health center, a healthcare system, a recovery-oriented community group, a representative from the criminal justice system, working together. And here are the things that we have been doing that could be augmented by singled, one-time infusion of funding. Again, going back to Jay's comments, everything that we do in this space has to be built from the outset to mitigate the cliff effect, so that we don't leave things worse off than we found them by kind of putting ourselves on the hook for long-term funding. So this is really meant to bolster infrastructure, to be startup funds with sustainability built in. And the more suggestions that you get back to planning teams in advance, the better this whole project will be. So those types of blueprints and partnerships of things that work are welcome at any time, at any point.
Any other questions for Jay? All right. Well, thank you. And with that, finally, we've asked Devin McDonald from the Criminal Justice Institute to share some updates with the commission.
Thank you. Thank you very much. So I've just got a brief update. So as many of you know, the Criminal Justice Institute works with and oversees the varying local coordinating councils around the state of Indiana. So with that, we're entering in kind of the second year now of a more uniform and revised approach about how we deal with and oversee the LCCs. With that, it's seen fantastic growth. CJI's overall satisfaction or approval rating among the LCCs has increased dramatically over the past year with that. We've seen better development and data-driven decisions by the local coordinating councils as part of the development of their comprehensive community plans. They're using the data, the information, the technical assistance that we're providing to help develop more SMART goals for their comprehensive community plans and how they're addressing issues like behavioral health, substance abuse, alcohol abuse at the local level, seeing more participation at the local level with kind of the multidisciplinary approach that Dr. Sullivan and Jay both spoke to, with involvement from criminal justice, behavioral health, mental health, as well as other social services within those. As we ended our calendar year for the LCCs, differs a little bit. So we start April 1st to the end of March for the LCCs and the development and submission of their comprehensive community plans. As of right now, last year we had 87 approved plans out of the 92 counties, which is significant improvement over where things have been in the past. And they've all submitted their fourth quarter reports again, which is significant improvement over where we've been in the past. So I wanted to just kind of extend some gratitude and some kudos to my staff, Michael Ross and his staff, for the technical assistance and the improvement on the work that they've done with the LCCs over the last year. And one of the things also is that one of the big projects that we've done is we have some local grants that we've extended throughout the course of the next year. One of those being kind of a coalition development grant through the Indiana Coalition Network, which has seen huge success and strengthening the LCCs around the state. So we're anxious to see how that continues to grow. We have a couple other counties that are seeing success with the grants they provide. Hamilton County, for instance, has developed a local TV show that has several hundred viewers throughout the course of every week, which is pretty significant outreach for that type of a program, as well as they've developed a YouTube channel with the shows as well, which has several hundred followers on the YouTube channel. So we're very excited to see that, watch that program grow as well. Marion County also has developed and continuing to develop a program within the sheriff's office with the jail, the treatment program there, working with adult and child to provide substance use disorder within the jail, helping connect offenders with varying programs like HIP, Recovery Works, Medicaid. So again, we're looking very much forward to seeing that program develop throughout the course of the year and move forward. As far as the submission of the comprehensive community plans for this year, we've seen some significant improvement with that. We do have several entities around the state seeking some technical assistance with that, which we're providing. Our staff is continuing to have monthly updates with the LCCs and providing communication and development and technical assistance throughout those communications. So again, lots of progress. We're really excited to see what happens throughout the course of the next year with the local coordinating councils, with all the programs that have been mentioned here, and the assistance throughout the next year. I think will be really great, and we'll see some significant improvement with providing services and addressing some of these issues throughout the next year. So that's all I have. Thank you very much.
Well, thank you, Devin. Any questions for Devin? Great. Well, thank you to everyone who presented today, and thank you to the members for your time and attention. Just as a reminder, our next meeting is August 5th at 10 a.m., and it'll be in a format to be determined. Hopefully, we might be able to all join in person at that point. So looking forward to that. But thank you for joining us, and we stand adjourned.